Hi, if you're watching this video, then I know that you are trying right now really hard to either avoid an induction or you're still debating whether or not this is right for you. And the first thing I'm going to tell you is that we are in an induction epidemic. It feels like every single mom in the mom group asks this question weekly, sometimes several times a day. Sometimes I've seen this post come up like it's like one after the other. And I'm like, is this the same person? And it's not. So, what's going on here is that you have either recognized that you're not going into labor on time, or your OB or midwife is suggesting ways to get things moving, or they have already told you that they're going to schedule your induction for next week or a few days from now, or maybe this is something that you just know they have a policy around. First of all, what I'm going to tell you is that induction of labor can increase your chances of having a C-section. I don't care what studies they tell you or how else they try to frame it to make it seem like it's not a big deal to induce. I don't care how many positive birth stories are out there from moms who say they would rather be induced than go through labor. Oftentimes, they don't know the difference between true natural birth and natural birth in the medical system, and that has informed their choice and created a bias against going into labor on their own. There are also women who maybe they were already going to go into labor on their own within 1 or 2 days. They have the induction and it just fast tracked it. So they were able to have their baby without the pain and trauma. But let me just tell you, there are way more stories of traumatic inductions than there are positive birth stories about them. Now, induction is an option if you have a true medical complication where you have recognized by tuning in to yourself that this is the right path for you. If you want to know more about that, then go and make sure you check out some of my other videos, or maybe even go and get my resource guide on how to make informed decisions. It's one of the bonuses that comes with my book, Your Empowered Birth. It's on my website. You can go to empoweringmomsbirth.com/extras and get the whole thing. So see, you don't even have to get the book. And at the same time, if you do feel called, it is available on Amazon. And of course, I share about induction all the time. So you're probably going to hear this information again. But the fact is that you need to decide whether induction is right for you. What you don't want to do is make the 3 big mistakes that a lot of moms make when trying to figure out whether induction is right. And I'm going to share that with you in a minute. But first, I'm going to tell you a statistic that most first-time moms, they end up getting told that they have to induce because they don't go into labor on their own by 40 weeks. And often they don't show signs of labor happening anytime soon. And I'm just going to be a little bit sassy here. I'm not going to say the words, but you're going to know what it is. This is the thing that you really don't want to do. Are we clear on that? The reason you don't want to check your cervix is simple. Your cervix is not a crystal ball. In fact, even if you are in labor, in active labor, like I myself was with my daughter, it doesn't matter. Your cervix can close up again if you feel stressed and threatened. So your body's physiological response is to keep your cervix closed and not go into labor if you're stressed. You can see now why being pushed into induction and feeling all of that stress and fear and overwhelm and anxiety of trying to avoid this induction can lead to you not going into labor on your own. You will go into labor on your own. Your body will birth. However, we got to get you out of this fear first. So before you make any decisions about induction, you need to learn about the 3 big mistakes, the traps that you're falling into that are going to lead to you agreeing to this induction or sabotaging your body's natural process. I do go deeper into how to avoid an induction inside my program, Your Empowered Birth Academy. Now, inside this program, you learn about how to advocate for yourself strongly in the medical system, even when there's pushback. Basically, you will have the confidence to say no to the induction. There's also a signature workshop that comes with your Empowered Birth Academy, in which there's module 3 teaching you more about how to avoid an induction. I go into the induction traps. I go into what you need to be looking at, and you learn how to make a decision based on your intuition, not falling into these 3 categories of mistakes that I'm about to reveal to you. So if you want to check that out, I will tell you more about that at the end of this video. But either way, if you're finding value with this, please like, share, and subscribe to all my social media channels. Pay it forward. Tell other moms about this, because I am honestly creating this right now, not just for you, but also because I am so tired of seeing the same thing in the mom groups over and over, knowing that I can tell them differently, but I can't be everywhere at once. So if you share this video, you're going to be able to help me in getting that message out to the moms that are going to be like, thank you. Thank you for sharing this with me, so that I didn't get tricked into an induction and I didn't have that trauma. Because as I said, a lot of the women that I've helped over the years, they have had traumatic inductions, and they're saying, how do I avoid having that happen again? If you're a first-time mom, you will never have to experience induction unless there is an actual medical need for it, and you will feel empowered in your decision, and you'll know what pitfalls to avoid. If you're a seasoned mom and you've already been tricked into an induction once, you know what that's like. You don't want it again. You were like, oh, hell no. If I can avoid this, I will do everything. But you're making a big mistake, and you're probably making one of the 3, or maybe all of the 3, because you're really like determined not to induce, right? Like, you know what that path is. First time mom, you may not know just how bad it could be, and you're thinking, well, maybe I should do it. A lot of first time moms do get tricked, and they do get talked into induction, specifically because first time moms, the average gestation of a first time mom is 41 weeks and 3 days, and the medical system tries to induce all moms before 41 weeks. So if they're trying to induce you before 41 weeks and you go into labor after that, naturally, you can see the problem here. And then, of course, there's the third category, the VBAC mom. Maybe that induction led to a C-section, because induction is messing with the true natural birth process of your hormones, and it can cause you to go through that cascade of interventions that leads to the C-section. In fact, one of my empowered moms, Rebecca, who's inside your Empowered Birth, she had a vaginal birth after 2 previous C-sections at home. The reason she had her first C-section is because she was induced. She was 18 years old. She didn't know any better. Her doctor told her that she had to induce. She said, okay. And of course, it didn't progress. And the OB is like, get up, dad. We're doing a C-section, tosses the scrubs at her partner. And Rebecca got a C-section. All because she failed to progress because she had been induced. And she didn't need to be induced. She was just told that she had to induce. Oftentimes, first-time moms aren't even told why they need to be induced. That's a whole other topic I can get into. And this is why I do what I do. So again, if you find value in this, please like, share, and subscribe. Pay it forward. Pass this on to other moms who need it. And let's get started with mistake number 1 that I see so often in trying to avoid an induction and advocating for yourself, because it ties together, okay? The idea is, why aren't you saying no? There's a mistake being made. Why are you agreeing to this? What are you doing to sabotage yourself? I'm going to reveal these 3 mistakes. Ready? So mistake number 1, you're falling into an information loop. What is an information loop? So basically, this is you trying to gather all the positive birth stories on induction, or asking other moms their opinions on induction, or asking whether you should induce, or trying to get information out there in articles that are going to explain the risks and benefits of induction, or trying to get pros and cons lists. The more of an information loop that you are in, this is just going to keep reinforcing the same fear traps. Now, go check out some of my other videos to learn more about the fear traps, but what this basically does is it's undermining your confidence. And it's giving you that self-doubt, because more information does not necessarily lead to you making a different choice. You already know you don't want an induction, okay? So why are you going for information? If you keep going for information, the implication of that is that you're going to add more things that are going to like cloud your mind and confuse you and have you thinking, I don't know what to believe. I mean, over here in my intuition, it says that I don't need to induce. But all of this information in the mom groups is saying that induction is much safer than what I want. And they're bombarding me with articles, and these articles say all these statistics, and I don't know what all these statistics really mean, but it sounds scary. And my OB is really putting pressure on me. And there's a mom who's telling me that there's a horror story about induction, but she's also saying that she's glad she had it. And then there's another mom that said her induction went fine. And like, if you're doing that, you're in that information loop, especially if you're only asking for positive birth stories. What you're really saying to yourself is, I don't trust my intuition. And I need somebody else to convince me to do the thing that I don't really want to do. That doesn't feel right to me, but I need to be convinced. If you need to convince yourself with information, it doesn't matter, because you're still going against yourself. This leads to the next one, the next mistake that you are making, which is jading. You're jading yourself. This stands for, if you've decided that you don't want to induce, you are justifying why you don't want to induce, or you're trying to find reasons to justify why you don't want it. You are arguing with your care provider about why you should be allowed, or arguing with other people and saying why you don't want this. You are trying to defend yourself because you're feeling on the defensive about why you don't want this. And you're also explaining, because the defensive point is now you're going to over-explain. The problem with this is that if you go into the medical system and you've decided, I don't want to induce, how do I convince my care provider that I don't have to induce? They're putting a lot of pressure on me. Can you give me articles that I can give to them? Can you give me studies that I can show them? Can you tell them, like, can you give me reasons that I can use to tell them why I don't want this, to get them to change their mind? No, because what's going to happen when you do that is they're going to come back with their stuff. And then that's going to try to invalidate what you said. The truth is, you don't have to tell them why you don't want to induce. You don't have to justify your decision to not induce. Even if they are recommending an induction, even if they have all of the reasons why they think you should do it, if you don't want to do it, you just say no. And I know that that can be really confronting, because you probably had a time in your life where you had to justify, but you really don't. You know, if you want to be really cheeky, you could say my horoscope said I shouldn't induce. It doesn't matter. It really doesn't matter. You don't have to tell them why. It is their job to tell you what their recommendation is and why they recommend it. However, it is your decision. So do not jade yourself in any aspect of your life, and especially not your medical decisions when it comes to your pregnancy and your birth. Because when you're doing that, you're basically staying in that area of, I want you to argue with me. And if they argue with you, they're going to make you try to change your mind. They're going to keep pushing back. If you don't invite the pushback in because of the way that you stand up and you refuse to jade, they can't do it. There's nothing to dance against. If they can't do their thing because you haven't invited it in, you win. You can say no. And I have another video called How to Advocate for Yourself that you might want to check out as well, with the big mistakes that you're making. And I talk more about jading in that video. So go and check that out. It's at my website, empoweringmomsbirth.com/masterclasses, or you can find it inside my YouTube channel. All right. So let's move on to the last one, because the last one is a big one. It's called compromising. You've decided you don't want to induce. You've decided that you want to tell your care provider no. But instead of it being a hard no, you are trying to avoid that confrontation with number 3. By compromising, here is what that looks like. Maybe I'll get a membrane sweep. No. Hate to break it to you, but a membrane sweep is still an induction. It's still interfering with your natural birth process. It's still a natural birth trap. I talk about this all the time. When you're wanting a true natural birth, you do not compromise. If you compromise and get a membrane sweep, this can lead to more pain, more intervention, infection. Your water's accidentally or even accidentally being released, which then leads to you having to go and have that induction because baby wasn't ready. Or it just weakens the membranes, so they rupture too early in your labor process, leading to more pain. There are so many things that I could say about membrane sweeps. I don't have enough time to get into that. But the idea is you're compromising by agreeing to a lesser intervention to avoid the induction that you don't want, but it's still an induction. Let me be clear. Anything that is interfering with your body's natural process and how your baby needs to get their systems in place and get everything ready, because your baby decides when they're ready to be born, not your doctor, not the arbitrary timeline. It's like with the flower. If you're looking at a rosebud and it's just starting to bloom, you don't keep prying apart the petals, but this is what we're doing in our birth culture. This is what we're doing every time we try to do all of the things to get into labor. So if it's not a membrane sweep, if you're trying to avoid that too, maybe you're doing the miles circuit. Maybe it's spicy food. Maybe it's sex, nipple stimulation, all of it. All of the things that you are going into the mom groups and saying, hey, how do I get into labor? You know how you get into labor? You wait for your baby to be ready, and then your baby will signal to your body that it's time, and then the contractions will start. If you do it before that, you're going to run into the natural birth traps. You're also going to interfere with the physiological birth process. Go and check out some of my other videos where I talk about why you don't want to mess with this process and what happens when you do and labor starts to start, but then it's more painful and you're wondering why it's not progressing. I'll tell you more about that another time. But this is basically what happens when you compromise, is you are interfering with your own process. You are sabotaging your natural birth. You don't want to do that. All right, so now you know the 3 big mistakes. And before I go into the last piece of this, where I'm going to share a quick and easy method for you to decide whether or not you actually need an induction, whether it's true for you or whether you need to say no and set a boundary. I'm just going to remind you that my program, Your Empowered Birth Academy, teaches you the skills on how to advocate for yourself. It allows you to get past your fear, avoid those fear traps, see the loopholes in the medical system. It comes with my signature workshop, Your Empowered Birth Workshop, which also has a module on how to avoid induction. So you want to check that out. Go to empoweringmomsbirth.com/academy. And again, if you're finding value in this video, if you're like, oh my gosh, people need to hear about this, then please spread the word. Send this out to other moms. Drop this video link inside other mom groups. Tell people where to get my information. Go and get my book, Your Empowered Birth. Support the empowered birth movement. But now we're going to go into the last piece, because I'm always going to give you an action step that you can take to help you get out of your fear whether you work with me further or not. I am committed to you having an empowered birth. You deserve it. You don't deserve to get tricked into an induction. I'm tired of seeing birth trauma out there. I'm tired of seeing moms getting pushed into induction that then leads to C-sections. The gloves are off. So, are you ready? Because this is magic. This is exactly how my best friend and business partner, Jenny, who's also the star of Empowered Birth, she also created this t-shirt. So she did this. She had chronic high blood pressure, gestational diabetes. She was 41 years old. She was going for a VBAC. She had a history of preeclampsia with her previous pregnancy. And she was worried that the medical system would push her into an induction. She also had recognized that her blood pressure was rising at a certain point near the end of her pregnancy. And of course, the medical system likes to tell you that if you have gestational diabetes, you need to induce. And if you have high blood pressure, you need to induce. Like it's like almost a given, especially since she was also 41. Older moms get this as well, don't we? But here's the thing. Here's what Jenny did. So here's what I'm going to tell you to do. You close your eyes, take a deep breath in through your nose, into your belly, and let it fill up with air. And then you let it out twice as long. And just focus on your body for a moment. Let yourself relax. Get into a nice, calm state. This will also help you during labor, by the way. This will also help you when you're making any decisions in your life and when you're dealing with your kids, when they're throwing tantrums or as they get older, become preteens and they're sassy, to be able to come up with the best response, not the one from fear and not the one from automatically reacting, but instead being able to be in your truth. So now that you're nice and calm and your body is relaxed, I want you to close your eyes and think about induction. If you chose induction, if you actually agreed to that, and notice what your body is doing. Do you feel like expansive and be like, okay, yeah, this feels right to me? Or does it feel narrow and contracted and not good, like icky? There's something icky. I don't know what it is. It's different for everyone in like how your body responds. For me, I kind of get like this tightness in my chest. For you, it might be up in your shoulders. It might be in your stomach. Wherever it is, if you notice a tightness, a contractedness, feeling of, that doesn't feel right for me. Notice that. Now take another breath. Let that feeling go. And then think about not inducing. Your plan to not induce, just saying no. And notice what that does. How does it feel to say no? Does it feel a little bit better? Does it feel a little bit scary, but still much better than agreeing to an induction? If that's the case, then you probably have some fear around saying no. Then you need to examine what that fear is. Again, inside your Empowered Birth Academy, I teach this at a deeper level. You can also check out some of my other videos on the fear traps and dealing with advocacy and dealing with your own fear and anxiety around saying no. I do have those, but the fact is like you're recognizing there's some fear there. It will feel good to say no, and you're scared. Or maybe you have no fear and you're like, I know that I'm not going to induce no matter what. And no matter what they say to me, I'm good. And I feel lighter now, knowing that, yeah, this is really not for me. So that's the trick. You really just tune into your body and see what feels right for you. No information loop, no jading, and no compromising. All right. So again, if you found value with this, please like, share, and subscribe. If you do want to jump into Academy, just go to empoweringmomsbirth.com/academy. It's a self-study program. It's almost as good as if I was coaching you, but you're going to get the same result as a lot of my high-level clients. I don't work with everyone at the one-to-one level. I don't even work with everyone at the laser coaching level, but I want you to get that help no matter where you're at. And even if that's too much for you right now, you can go and get my book, Your Empowered Birth. That will start you on the journey. You can ask questions, send me an email, hello@empoweringmomsbirth.com. Wherever you're at, I'm here to serve you. Thank you so much for watching and happy empowered birth journey. I'll talk to you soon. Bye.